Hi, Farmies. Today we're going to talk about an antibiotic for serious infections. Can you guess which one it is? Vancomycin. All right, so vancomycin is a drug that we use for infections that have become resistant to other safer antibiotics. So MRSA would be an example. C. diff would be another example of conditions that we use vancomycin for. So vancomycin destroys the bacterial cell wall. Your patients could have side effects like ototoxicity, renal toxicity, phlebitis, because this is such a serious antibiotic. You want to hang it with a secondary that will flush off your line so that the drug never is stagnant in the patient's vein. I have a little picture for you for Vanco. So here's a red man. Red man syndrome is something that can happen with vancomycin if the infusion is given too quickly. It's called an infusion reaction. His little face is a clock that is 60 minutes, and it says slow. We want to give the infusion slowly over 60 minutes. Red man syndrome, your patient would exhibit flushing of his face, neck, chest. If that were to happen, you would stop the infusion and talk to the provider. If the patient tells you it's happened before, it's probably not a true allergy to vancomycin. It's just an infusion reaction because someone infused too quickly. You can pre-medicate this patient and infuse slowly over 60 to 90 minutes. I have a picture of a mountain and a picture of a trough. If any of you are from the country, you'll know what a trough is, something you feed horses out of. It's also the bottom of a curve, like the lowest point. So a trough represents the lowest level of vancomycin in your blood. A peak represents the highest level of vancomycin in your blood. So you'll follow your institution's protocols for monitoring vancomycin levels, and these levels, along with some other labs like creatinine, would be used so the pharmacy could gauge the dose of vancomycin that your patient needs to get. So things that you need to remember for vancomycin: red man syndrome is possible if it's infused too quickly. You may need to pre-medicate your patient with diphenhydramine or some other antihistamine and infuse slowly, 60 to 90 minutes. I hope you can see that. Can you see that 60 minutes in there? So red man syndrome, infuse slowly, monitor for peaks and troughs. That's what I can tell you about vancomycin. Hope that helps you remember this medication.